actually a really good question. I actually get this question a lot. So I am a physician assistant, but I have lots of colleagues that are nurse practitioners. So let's break it down in simple terms. What's the difference? So even though PAs and nurse practitioners are not the same thing, we're very much cousins in the healthcare world. So PAs go through a medical school model training. So I went to my undergraduate and I have a Bachelor of Science, and I was in the same undergraduate programs as these people going to medical school. Instead of going to medical school, I went to PA school, which is a totally different school. So in PA school, we train in all different specialties of medicine, but in a very condensed time frame. So it's like an accelerated program. It took me about 27 months to complete it, but it was full-time year-round. Now, as a PA, I have a master's degree. Now, on the other hand, nurse practitioners always will start out as registered nurses, and then they get their bachelor's of nursing, and then they go on to either get a master's degree or a doctorate degree of advanced clinical nursing. So to be a nurse practitioner, you always have to be a registered nurse first. I, as a PA, was never a nurse. So the things that are the same, we can both diagnose, treat, prescribe medications in all 50 states. So since PAs are trained in the medical model, we can usually work in any specialty. Now, nurse practitioners normally pick a focus area like family medicine, women's health, psychiatry. However, I do have lots of nurse practitioner colleague friends that work in different specialties, so that's not 100% true, but I know some of my colleagues have had to choose when they went to nurse practitioner school which their scope of practice was going to be. As a PA, I did not have to pick a scope of practice while I was in school. So most PAs work under a supervising or collaborating physician, so think like team-based care. Fun fact, I've actually worked with the same physician for the last 17 years. So nurse practitioners can also work in a team-based care situation, but in a lot of states, they can actually also work independently. Bottom line, PAs and NPs, we're not really competing. We're kind of teammates in the whole healthcare process, and I have a lot of friends and colleagues that I work with that are NPs that are great. But it's definitely two very different paths to get to a very similar place. So I hope that answers your question, but if you want to know more, just let me know in the comments.